So we're going to briefly talk about the lap band procedure. The lap band procedure, as you may be aware, primarily is performed by placing a small implant around the stomach that'll give the patients restriction of food by controlling the portions. So the lap band is adjusted through a port that is placed underneath the skin. It is also performed via laparoscopy and minimally invasive techniques. Most of the time, this is an outpatient procedure or requires 1 day of hospitalization. It is primarily a portion control procedure. After the food passes from the pouch, eventually makes it into the stomach. There's no cutting of the stomach or alteration of the anatomy. It is also reversible. That means that we can undo the lap band or remove it if there's any problem. Most patients with the lap band procedure can expect to lose approximately 50% of the excess weight. As a laparoscopic procedure, is very well tolerated and extremely safe. It does require the patient to be committed to adjustments, nutritional recommendations, and follow-ups to be successful. One of the advantages of the lap band is that it's adjustable, is removable, is not permanent. One of the main disadvantages is that if the patients are not completely adherent to the recommendations over time, they can be treatment failures. So another disadvantage of the lap band procedure is that it requires to be adjusted. So patients may require 1, 2, 3 adjustments until we can find the right size that'll make them feel comfortable. The lap band patients follow the same preparation as a bariatric procedure, sleeve, or bypass. That means the patient needs to be compliant with the dietary recommendations before and after the procedure, until progressively the diet is advanced to a more soft consistency. Patients will have minimal pain, minimal discomfort, since the surgery is performed with minimally invasive techniques. The lap band procedure has plenty of years of history and it is completely FDA approved. Another important subject is that the lap band is covered by insurance if your medical policy has coverage for obesity management. The price range to be expected if you are a self-pay or private patient is in the range of $8,000 to $15,000. Fortunately, we do have affordable options for patients that are private or self-pay.